Hello everyone. In today's video, we will discuss the femur, also called the thigh bone. So the femur is commonly known as the thigh bone. It is the longest and the strongest and also the heaviest bone in the human body. The name of the bone is derived from the Latin word femur, which means thigh. It is the only bone present in the thigh region. It extends from the hip to the knee. It forms the hip joint and the knee joint. Now, this bone also helps to support all the body weight while we are standing and while we are doing other activities like running, walking, and also jumping. The femur is actually a long type of bone. That is the type. It is a long bone. Its length is approximately 17 to 18 inches, and it articulates with the hip bone and also with the knee bone. So, for the function of the femur, it supports all the body weight during various activities such as running, jumping, walking, and even standing. It also provides stability by balancing and coordinating the muscles. So now let's look at the anatomy of the femur proper. So the femur is a long bone with two ends, the proximal and the distal end. So the end that lies on the side of the hip is called the proximal femur, while the other end that is on the side of the knee is referred to as the distal femur. So the region between these two ends are called the shafts of the femur. So let's talk about the proximal femur. The proximal femur, this region consists of a head and neck and also two bony processes, the greater and the lesser trochanter. It also has two bony ridges that connect the two trochanters. Now again, the proximal end of the femur forms a smooth spherical process which is called the head of the femur. Now this round spherical head forms a ball and socket hip joint by articulating with the acetabulum of the pelvis. So the head remains covered with articular cartilage except for an ovoid depression called the fovea capitis, where the ligament capitis foramis resides. Now the neck of the femur. Now the femoral head narrows considerably to form the cylindrical neck that connects the head with the next region, which is the shaft. So the neck is approximately 5 centimeters long and it can be subdivided into three regions: the subcapital, the mid-cervical, and the basicervical. So the subcapital is actually narrower than the basicervical, but it is wider than the mid-cervical. It lies towards the side of the femoral head. Then the mid-cervical is actually the middle section. Between the two regions, and it is the narrowest part of the neck. Then the basicervical, also known as the base of the neck. This is the widest part of the neck and it lies closest to the greater trochanter. Now this takes us to the trochanter. As stated before, the proximal femur forms two bony processes, the greater and the lesser trochanter. So the greater trochanter is a large, irregularly shaped trochanter. It is present laterally and posteriorly. It actually bears two surfaces and four borders to which several muscles attaches itself. It also bears a crescent-shaped rough depression called the trochanter fossa, and this is found on the medial surface of the trochanter. Now, the lesser trochanter, unlike the greater trochanter, it is smaller and it projects from the posterior medial side of the femur. Like the greater trochanter, it also has several muscular attachments. Now, let's talk about the intertrochanteric line. So it is actually a ridge of the bone that connects the greater and the lesser trochanter on the anterior side. So this section of the line lying below the lesser trochanter and the posterior surface is also known as the pactineal line. So again, we have the intertrochanteric crest. So like the intertrochanteric line, it is another ridge of bone that connects the two trochanters. So unlike the previous one, it is quite pronounced and it is located on the posterior surface of the femur. So there is a round tubercle on its upper half called the quadrant tubercle. Now let's move over to the shaft of the femur. So the shaft of the femur is a cylindrical structure that is wide at the proximal end but narrows towards the middle. So the anterior portion of the shaft is actually smooth, whereas its posterior surface is roughened, and it is called the linea aspera. So the linea aspera diverges to form the medial and the lateral supracondylar lines. So the flat popliteal surface lies between the two supracondylar lines. So at the extremity of the medial supracondylar line, there is an abductor tubercle. Now the medial border of the linea aspera meets with the pectineal line, whereas the lateral border gives rise to the gluteal tuberosity. So towards the end, the linea aspera widens and forms the floor of the popliteal fossa. Now let's talk about the distal femur. So the distal end of the femur features the medial and the lateral condyle, and this articulates with the tibia and the patella, forming the knee joint. So it also has the medial and the lateral epicondyle and the intercondylar fossa. So let's start with the medial and lateral condyles. So these are actually rounded areas present at the distal end of the femur. Their anterior surface articulates with the patella. On the other hand, their posterior and the inferior surface articulates with the tibia and the menisci of the knee. So out of the two condyles, the lateral condyle is larger and more prominent than that of the medial condyle. Now let's talk about the medial and the lateral epicondyle. These are actually bony elevations that are present on the non-articular areas of the condyle. Out of two epicondyles, the medial one is larger and more prominent than the other. So the intercondylar fossa. The intercondylar fossa is in between the two condyles. So in between the two condyles, there is a deep notch on the posterior surface of the femur. It is called the intercondylar fossa. Now this fossa is limited anteriorly, by the patellar surface and posteriorly by the intercondylar line. So the lateral surface of the medial condyle forms the medial wall of the fossa, while the medial surface of the lateral condyle forms the lateral wall. Now let's talk about the joints and articulation of the femur. So the first joint, we have the hip joint. This is actually a ball and socket joint where the rounded femoral head acts as a ball, while the acetabulum of the pelvis acts as the socket. Then the knee joint is actually a hinge joint formed by the interaction of the medial and the lateral condyle with the tibial and the patella. Now let's talk about the muscles and the ligaments. So a lot of large muscles arise from an insert in various parts of the femur. So some of the muscles include the vastus lateralis muscle, the vastus intermedius muscle, the vastus medialis muscle, the bicep femoris brevis, the popliteal muscles, the gastrocnemius muscles, and the platteric muscles. Now there are actually other muscles. You can actually go and read more on that. So let's talk about the ligaments attached. Ligaments attached to it include the transverse acetabular ligaments, the ligaments of the head of the femur, the anterior cruciate ligaments, the posterior cruciate ligaments, the fibula or the lateral collateral ligaments, the tibial or the medial collateral ligaments. Also, there are other ligaments, and you can go and read more on that. So the blood supply to the femur include the deep femoral artery, the medial and the lateral circumflex femoral arteries, the obturator arteries, and the fovea arteries. So now let's talk about something that is very important. This can actually help radiology students or students of anatomy. How do you identify the left and the right femur bones? Now there are actually two quick ways to identify the left and the right femur bones. Now, the first one is hold the bone or keep it vertically on a table. Now, look at the side that the globular head faces. Now, if the globular head faces the left, then it should be the right femur, and if it faces the right, it should be the left femur. Now, the second way is to hold the bone and look at the intercondylar fossa. If the fossa faces you, then it is the right, and if the fossa faces the other side, then it is the left. So I hope you found this video helpful, and please give it a thumbs up, and also you can subscribe for more videos like this. See you in the next one, and thanks for watching. Bye.